This is part 2 of Understanding the Affordable Care Act. Part 1 can be searched on our website, www.wgby.org/connectingpoint. We talked about the history of healthcare, where it came from, and why it's being brought to the federal level. Well, here to talk about how the parts of this bill affect employees and their employers is Nicole Miner, Employee Benefits Consultant at Dowd Financial Services, which is the oldest insurance agency in Massachusetts. And she's been working day in and day out, specifically dealing with this healthcare law. So talk to us about what this will mean, not just in general, but I think people get the concept that, oh, this is national health care, everybody's going to have health care, but do employers have to provide health insurance?
The short answer is no, they don't have to. Back in 2006, Massachusetts healthcare reform was passed, and at the time, the mandate was that any employer who had 11 or more full-time employees had to either A, offer health insurance, or B, pay a fair share contribution to help fund the Health Connector. Fast forward to present day, and you have the Affordable Care Act, which says that any employer who has 50 or more full-time eligible employees has to either pay or play. And that means either offer health insurance that meets a minimum essential value and is affordable, or pay an assessed fine or assessed fee to the local Health Connector if you're not going to be offering coverage.
Which route do you think most employers will take when they kind of look at the options and say, well, it might be cheaper for me to either cut my employees below, is it 30 hours that they have to
30 hours.
Be at, or will they say I'd rather pay the penalties? I mean, which way is this going to go for on the employer side?
I think without a doubt the penalties are less expensive than offering coverage to your employees. However, here in Massachusetts, we've been dealing with this since 2006, and so I think we're used to having to offer coverage, especially employers with 50 or more employees. They're offering coverage right now. Also, I think that you kind of get what you pay for, you get what you offer. If you're offering benefits to your employees, you're attracting a higher quality employee, and so I think that's important. So I think in Massachusetts, you're not going to see a lot of employers dropping coverage and sending their employees out onto the exchange. Nationally, it could be a different story, but here we're kind of used to the status quo.
Okay. Now, what will be the biggest change for Massachusetts employees, or will there be any change?
I think it depends on the size of the group that they are. If it's a small group, I think the only thing that the employees are going to be looking at is probably some rate increases because there are fees that are associated with the Affordable Care Act, and those are being passed on to every member. So that's something to be prepared for, whether you're large or small group employer. Also, every plan for small group is required to offer a pediatric dental provision in it. So every child member under the age of 19 is now going to have full dental coverage. So that's a good thing. On the large group side, you're going to see employers that need to make sure that their plans are affordable. And what affordability means is that the amount that the single employee contributes to their health insurance cannot be more than 9.5% of their household income or box 1 on their W-2. If it is, that employer is subject to a fine of $3,000 if they have even one employee go to the Health Connector for a subsidy.
Gotcha. So they're trying to keep as many employees underneath their employer coverage as opposed to going to the subsidy.
Yep.
Okay, great. Now let's talk about, we had a couple questions on Facebook that I want to get to, and then we'll get to some other questions as well. Ian says his big question was, after the employer mandate delay expires in January 2015, do analysts anticipate that employers will begin dropping employees into the exchanges?
So that's a bit of a misconception. The employer mandate is not delayed until 2015. The employer mandate still goes into effect January 1st, 2014. The fees that are associated with the pay part of pay or play, those are delayed until January 1st, 2015. At Dowd, we are making sure that our clients are in compliance upon their 2014 renewal.
Okay. All right. So there's a little bit of a misconception there?
Yep.
Okay. And then we have Ken who says, if I like my plan, can I keep it?
Yes. So In Massachusetts, the answer to that is yes. The carriers are definitely making changes to their plan designs. They're increasing copays, decreasing copays. All of it is in an effort to be compliant with the actuarial values that ACA is saying that the carriers have to meet. So you may see changes here and there. There's also some housekeeping going on. Now's a good time for the carriers to start canceling plans where there's not a lot of enrollment, but they're not canceling policies. If you have a plan that the carrier is not going to have anymore, you'll default into the most similar product aside of that. The only people who are getting cancellation notices in Massachusetts are the folks that are on the Health Connector, and the reason for that is that they need to reapply because the subsidy formulas have changed, the plan designs have been completely overhauled, and so those are the only people that need to go back out and reapply for coverage is out on the Health Connector.
Okay, now we do have some viewers that are not in Massachusetts, Connecticut, even the lower parts of New Hampshire and Vermont. How will this affect them?
Well, they should definitely be checking out their marketplace. Any individual should check out their marketplace, especially if they have a lower income and they're not eligible for health insurance through an employer, because you could be getting a subsidy or a discount on your premium. And so those marketplaces are popping up in all of those states. They're already up and going, and they should, go onto the website and check it out. As far as the employer mandates, we really do focus on Massachusetts. But for instance, in Connecticut, people were subject to underwriting, in the past, and now they're not, you can't look at pre-existing conditions, so that's not going to be a factor anymore. So there's a lot of changes happening outside of Massachusetts.
And just announced today, President Obama said that anybody who had received basically those cancellation letters saying, oh, sorry, it doesn't apply under the new healthcare law, that they were going to be accepted now. Will that bring about any change?
I think that comment that he made was a really general statement that was made a while back. It was taken out of context. I think what he was trying to say was, when he says if you like your plan, you can keep it, what he meant was, we're not going to change everybody over to government, health care. You can stick with your private carrier, but there's absolutely changes going on within all of the plans because they have to meet that actuarial value that ACA requires.
Okay. Now, right now, 98% of Massachusetts, they're insured. Will this happen on a federal level? Will this happen nationally?
So Massachusetts attacked healthcare reform in two phases. The first phase was, let's get everybody insured, and they did that. We have 98% of Massachusetts residents with insurance. Phase two was to tackle healthcare costs, and we're not finished doing that yet. There is a bill, a healthcare cost containment bill, in the Massachusetts legislature right now. It is incomplete. There are so many things that go into why the cost of healthcare is where it is. It's not just the providers or the carriers, it's the cost of malpractice insurance is extremely high, and doctors are ordering tests in order to protect their liability. There's all kinds of things that go into why everything is so expensive. In my opinion, until you let Massachusetts finish phase two, why would you roll this out to the rest of the country when it's not complete yet? I think you need to let Massachusetts complete the exercise and then roll it out. We were supposed to be the guinea pig for this, and it's premature.
Okay. Well, thank you so much for coming on board and telling us about this. Thanks, Nicole.